Hi everybody, Mary Biancalani here with another Trigger Point Self-Care video. Today we're going to be talking about muscles in the abdomen that can refer all the way around and cause pain into the low back. So we want to remember it's the trigger point therapy model that teaches us that trigger points found in skeletal muscle can about 80% of the time refer pain or sensation to a distance far away from where the muscle is actually located. So in this case, we're going to be talking about two muscles that are located in the abdominal region that can refer pain or sensation around to the back. So the first muscle we're going to talk about that magically appeared is the rectus abdominis muscle, the six-pack ab muscle that runs right along the front of the abdomen, from the bottom of the rib cage all the way into the pelvic bone or the pubic symphysis. As you can see, trigger points in the lower rectus abdominis muscle can refer pain that runs horizontally across the low back. Prior to publishing my book, I did hear from Dr. Simons, and he let me know that he would have put trigger points in each one of the tendinous inscribed segment of the rectus abdominis so that we would have referred pain going horizontally across each one of the different segments of the rectus abdominis. That's a little inside tidbit for you guys. The other muscle we're going to talk about, ta-da, is the psoas muscle. And again, that is a deep hip flexor. It is a deep torso flexor and a stabilizer. The psoas muscle, when harboring trigger points in the abdominal portion or the umbilical portion of the muscle, can cause referred pain that goes up and down the low back near the spine. So you can see the comparison of these two illustrations and be very clear. Rectus abdominis, think across the low back. Psoas goes up and down near the spine, and always the right psoas refers to the right low back and the left psoas refers to the left low back. So let's get to the self-care. Remember, you want to start with the least dense or the least painful self-care tool. So I'm going to start with the 7-inch versus a 5-inch ball. We're going to lay on our side. We're going to tilt our pelvis upward so that we can bring the ball to treat the middle segment of the abdominals, rectus abdominis, and the psoas. I'll hold the ball here. I'm going to roll over and allow my torso to relax, and I allowed my other leg to come over. If this isn't interesting enough, the bottom leg, which is your straight leg, is going to scooch backward, ta-da, bringing the bottom leg into more extension. You can also take your upper body, bring your arm backwards, so that brings your torso into more extension. We're going to breathe in, exhale, and allow the abdomen to be relaxed. You're going to stay here for 15 to 20 seconds. Tuck your flexed foot, leg, toe under, lean over, bring the ball down an inch, repeat, and relax. Same thing from here. We're going to repeat this multiple times till we get the ball all the way down toward the pubic symphysis or the pelvic bone. Remember, we want to keep scooching the bottom leg back and the top arm back. To make this more intense, you're going to now, later when this gets to be easier to do, you're going to use a smaller ball and apply that compression starting at about the belly button and working our way downward. To be more advanced, we're going to come on up on the elbow. I'm going to keep the ball there, rotate my torso to the center, and now I'm able to treat the rectus abdominis and the deeper psoas while my torso is in extension. If you have any back pain, it could be because you're getting referred pain from the psoas or the rectus abdominis, and you also need to make sure that the back muscles are staying relaxed. Later, as you're able to be more advanced, you can bring yourself straight forward and allow the ball to sit on the lower pelvis just above where the bladder area would be, and also bring the ball almost all the way down to the pubic symphysis or the pelvic bone. So to stretch the psoas, you'll see some other videos I've got for you, but of course, Now I'm showing you the opposite side that I treated just for the sake of the video. We can lean, lunge forward, keep the torso upright, and this will allow you to stretch the psoas muscle for stretching the rectus abdominis muscle. Again, we can go into any one of these cobra poses or up dog poses that allow us to stretch there. You could also be more passive and make a pile of pillows and allow yourself to lay over a pile of pillows. I don't have that here, but you could do that. So there's lots of self-care, helpful hints for treatment of low back pain that either goes up and down. And what muscle causes up and down low back pain? You remembered the psoas, very good, on the same side, or the rectus abdominis, the lowermost trigger points near the pubic symphysis can cause pain that goes across the low back. Here's the illustrations one more time for you. So remember, we're going to use treatment of the rectus abdominis and the psoas to get rid of pesky low back pain. So we look forward to seeing you in our next video. Saying goodbye, Mary Biancalana, the Chicago Center of Myofascial Pain Relief and Muscle Health, LLC.